how can you use marketing in a way that is using some of the new technology as well to create that better experience.
From a marketing standpoint, I believe that the future will belong to the brands that are most connected, not
Yeah.
necessarily the loudest,
Yeah.
right? And now that's a loaded question. Loaded question.
Have you seen that? Like again, it's more touch points now that are needed just to capture that attention and get that repetition in someone's mind to say when it's the right moment.
I
Hey,
think we're headed towards, the convergence of really aesthetics, technology, and modern pop culture. The manufacturers that are going to be successful are the ones that are going to be very much connected at the convergence of those three. Of being able to have conversations and dialogue with both of those segments. And I think that overall, to me, that's key to success.
hi everyone, welcome back to another engaging podcast. I'm your host Stephen Handisides, and I have Sheldon Larson, who is the VP of Marketing for North America at ALMA. How are you, Sheldon? It's good to see
I'm
you.
doing great. Doing great. Thank you for having me. It's been a wild ride. It's my first 100 days here at Alma, North America, and we're having a blast. We're having a blast, but grateful to be here.
Fantastic. You've been in the industry for quite some time. You've worked in a lot of different types of marketing roles. You've seen, a lot of new trends. You've seen a lot of different challenges that companies have been facing. Where do you see the industry at the moment, where it's sort of heading? So where you started in aesthetics, and then where do you see the transition today in terms of really sort of marketing, how to sort of now the approach that you would need to take in terms of running the marketing for a company like Alma.
Well, I think it's interesting. Obviously, when I stepped into this industry, it looks a whole lot different now, right? You see the continuation of the industry just reinventing itself, right? And that's what's so exciting about aesthetics is that we continue to kind of evolve with the trends and with the way kind of we've seen new consumers approach this category. But overall, I think where we sit today, from my perspective at least, is really, I think, where we sit today and where we're headed are two different things. I think we're headed towards, the convergence of really aesthetics, technology, and modern pop culture, right? I really feel that the manufacturers that are going to be successful are the ones that are going to be very much connected at the convergence of those three.
Mm,
And so, from my perspective, what I'm bringing to Alma is really that approach because I think that overall, when you look at the practitioner, really, for the most part, they look, act, and feel quite a bit like the end consumer in most cases. And so I think we have an incredible opportunity there. But overall, we're just continually kind of focusing on bringing a more rigorous clinical effort to all of our products and making sure that overall that we have the best balance approach, not only commercially, but from a scientific approach to back up our commercial claims.
Alma's obviously one of the most credible brands when it comes to, medical devices. How do you, in terms of marketing, for all the marketers that are listening out there, there's so much noise out there, right? And how do you sort of cut through the clutter? How do you create enough noise? What's some of your like strategies that you use to sort of get your message out there to doctors and anesthetic clinics?
I think obviously when we saw the integration of TikTok, right? That's where I think for me, I recognized all of the misinformation, all of the clutter, right? And I think that that point in time, it was trying to figure out how we could remain focused and also have as least of distraction as possible because those are really mutually exclusive, right? And they're two different things. And
Mm,
so sometimes people will say, hey, we might have a lack of focus, but we're not distracted, and I think that there's an interesting balance there. But overall, I think for me and how we look at things, from a marketing standpoint, I believe that the future really will belong to the brands that are most connected, not
yeah.
necessarily the loudest,
Yeah.
right? And so to me, it's how do we build, foster, cultivate community, both with our healthcare providers and consumers, because we sit at that incredible cross section of being able to have conversations and dialogue with both of those segments. And I think that overall, to me, that's key to success, right? Is making sure we open that dialogue and feed, we have the ability to communicate, and we synthesize that information back because it's not a one-way dialogue, right? It should be a two-way, street. And I think at the end of the day, that will prime us for success as building community and not just using that as like a fluffy tagline, right? Or something that looks good on paper, but truly like exuding that. What does it actually mean? Right. And I think that that is something that's a unique differentiator that I bring just in the years of experience I've had in this industry is making sure that, we stand behind our community, we listen, and that we really prioritize kind of their feelings and ultimately their beliefs about where we're headed and what we should improve.
Yeah, that's great. I mean, you're in a sort of you've got a lot of responsibility, and we were just talking about you have a lot to do right now. What's some of the sort of the key areas that over the next sort of 90 days that you've been tasked with?
Yeah, that's a loaded question. Loaded question. It's always exciting when you join a new company, right? I think at the end of the day, Alma has such potential, right? I joined the company because I really believe in the technology. It's funny, I just said like it's a full circle moment, right? I entered aesthetics by way of actually helping plastic surgeons and dermatologists build out their patient acquisition systems. And in that very first practice that I was a part of, they actually had all of Alma's technology. So,
Okay.
I said to the team, like, hey, I have a familiarity here. I know the Alma Harmony. I know the Soprano Ice. I know the V-Shape, like all of these devices. Now they've evolved certainly over that time, and some aren't in the portfolio anymore. But I think, for me, it's just been a wonderful opportunity to come in and reinvigorate, reimagine some of our commercial efforts. And then, Alma has done some things very, very well, right? So how do we infuse those with more life and things of that nature? So I'm immensely grateful. I feel so much gratitude in the confidence they placed in me, and I think that we're building out an incredible marketing leadership team and group to come in and execute. But I think more so my focus on is not necessarily how others do it, but how we can do things differently,
Yeah.
right? Because ultimately that's what's going to be unique to us. That's what's going to set us apart. And, overall, I think if we use that as our North Star with our customer first and our lens, that will serve us well.
And that brings us on to a good point. We were talking about how can you be different? And it's around the customer experience, right? How can you use marketing in a way that is using some of the new technology as well to create that better experience for practices or the medical professionals you're trying to reach? Where do you get most excited about some of the new technology that's been coming out recently?
Yeah, look, from my perspective, I think honestly, in my first 100 days, I probably used the word experience far too often. But I think it's true, right? It's true.
Yeah.
At the end of the day, like I said, the market's dynamically shifted. And in that same time, consumer expectations have also shifted quite a bit. So have HCPs. And I think that overall, when you look at just the experiential side of the business, whether that be the experience of our healthcare providers in onboarding new technology or the experience of our providers in interaction with our sales reps or at one of our events, these things matter, right? And we want to make sure that they leave with that Alma feeling because ultimately we know at the end of the day, we want to wrap our arms around, we want to build that community. And part of that is truly a feeling, it's an experience. And so I think I've focused pretty heavily on making sure that not only do we have, set up a really nice framework and workflow to create that experience for our customers, but overall, ensuring that we have the checks and balances in place to ensure that it's consistent, right? And there's continuity throughout all of our touch points. But I think when you look at technology, it's the same thing, right? You have such a experience nowadays with social media and was right. It just continues to grow. AI, right? We were just walking through obviously the platform there, and I think overall there's such an opportunity sitting right there in that experience, and that can extend digitally, right? It doesn't all have to be in person. I think that's the interesting. That's kind of what is coming down the pike here. I believe that ultimately you're seeing more events happen, live that ultimately are really being experienced digitally, right? And you're seeing digital events, be natively built, in different environments that support and are just as valuable and as effective as on-site and live events. So I think it's interesting. It's evolved quite a bit since the pandemic, right? Where I think we're in the early stages of some of these things because everyone was kind of rushing to just react
That's right.
to the situation we were all navigating. But overall, I believe that just the experiential side of our business, especially in aesthetics, is highly influential in how we operate.
And look, I think from a marketing standpoint, they talk about, and you'd probably maybe know a few more specifics, but in the past, when we were doing marketing, it might have been three or four touch points that we needed to get before someone would actually inquire. But now they're talking that could be 9, 10, 11 touch points. And sort of how do we do that? Is it through we've got to do a little bit of everything in our marketing mix? We've got to do some newsletters, we've got to do some social media, we've got to be at the events. Have you seen that? Like again, it's more touch points now that are needed just to capture that attention and get that repetition in someone's mind to say when it's the right moment, hey, I'm looking for a new device, and they think of you. What's your thoughts around that?
Again, it's a big question, right? I certainly have seen, 10 to 12 touch points, right, is the last data that I saw just a few weeks ago.
Hmm.
And I think that represents exactly that, right? We have a crowded space, not only in aesthetics, but in general, people are getting hit with so much content, right? People consume content several different ways, several different platforms. It's our job to meet people where they're at in the moment with content that resonates. Overall, that can be difficult, right? And to serve content that's relevant, when you're hitting someone 10 to 12 times before they might be taking an action or truly interacting with your content, I think it's becoming increasingly difficult for marketers, right? To have that specificity and granularity into that that kind of a cycle, right? The life cycle. But overall, I think at the end of the day, the fundamentals stay the same. We have to make sure that we have clinical rigor. We have to make sure that we're building a community, and we have to make sure that ultimately, our patients, the experience within the practice is top notch, right? And those things are never going to change. I think that those are inherently threaded through everything that we do.
100%. Look, I think what I've found is that how can you personalize the message to the audience that you're speaking with? And what I mean by that is, we've got one particular client, it's a pharmaceutical client, and they have 12 different audiences. They've got physical therapists, they've got chiropractors, they've got, aesthetic professionals. And I think also now with technology, particularly what I suppose we've been focused on is someone will come in, it will recognize what type of person that is, whether it's a plastic surgeon or dermatologist, and it will feed them the right information at the right time rather than bombarding them a lot of the time on websites, right? That can be a little bit overwhelming, overcrowded. And I see a big shift towards that as personalized marketing, giving people just enough, but it feels like it's already tailored for them. So I
Yeah.
that's exciting.
I I think from my perspective, we're at Alma, we're talking quite a bit about building out a digitally progressive ecosystem, right? And to me, what that means is part of what you just said, making sure that ultimately, like I said, meeting people where they're at with content that resonates is first and foremost, right? And that's through a variety of different ways and formats. But ultimately, with automation, with AI, it's become increasingly more easy, I guess, rather I would say, right?
Yeah,
To get people to where they need to go within your content ecosystem and things of that nature. So while it's difficult because there's quite a bit of touches, right? Ultimately, I do think that with better data, more characteristics, personas, we're able to predict better who is kind of in our ecosystem and where they're at along the process. But overall, that targeting and that personalization is certainly helping as we guide them through and educate them along the way.
That's great. Hey, Sheldon, look, just one more lasting takeaway that you can give sort of other leaders in the marketing space that are in the medical aesthetics industry. What's a couple of your sort of great takeaways that they can learn from?
Oh man. From my perspective, I say at the end of the day, how you do anything is how you do everything, right? I preach to my team day in and day out that you have to have excellence in the small details. That truly is the difference between good and great. And I believe that. So I try to live that out at each and every day. It's difficult, don't get me wrong, and it's difficult to instill, right? But that is something that I continuously, preach and believe in. And I also say all the time, exceptional creativity will continue to keep our future bright, right? I believe that just by nature, I'm a self-defined creative, and I believe that in aesthetics, it's one of the most important things, right? So if we continue to be creative, our future will certainly be bright. So I say those are the two things, right? A little bit more philosophical, a little bit more broad stroke, but overall, it's something that day to day I continually see, and I think it's helped me.
Hey, that's great. I would expect nothing less from you, Sheldon. So, hey, it's been fantastic having you on this podcast, and I wish you very, very best for this new role at Alma. They've got the right man arming the helm there. So, yeah, congratulations on that new role and exciting times for you. So, thank you very much.
No, thank you so much, Stephen. It's nice to chat with you.
The Unite. Engage smarter, perform better.